We have the ability now to offer metastatic breast cancer patients years on their first-line treatment. And it is just astounding.
Now, you mentioned response rate. It was 85%.
Yeah.
Have you ever seen anything like that?
No. I mean, nor again the first-line PFS. This is incredibly exciting. And when I look back to the original approval of trastuzumab to where we are now, and it seems obvious, and these statements are made often, but it should never be lost on us what we have available right now to offer patients. And also, for the most part, this is a regimen that patients can feel very, very well on.
Yeah.
And again, I think there are a lot of complexities to the art of administration and duration of exposure and these things, which we should talk about.
Of course, yeah. And then the duration of response was really long, too. It was like 39 months. I mean, this is the highest response rate I've ever seen in HER2-positive metastatic breast cancer with any regimen.
Yeah.
So it's unprecedented.
It is, particularly when, as we all know, the HER2-positive patients can have, at times, a substantial visceral burden at the time of diagnosis.
That's one thing I wanted to mention about patient characteristics. Thanks for reminding me. It was about 70-odd% had visceral disease. So it was a visceral predominant population in this trial. Moreover, I meant to say in the patient characteristics that about half for de novo metastatic disease, we're seeing a lot more of.
Which was, and in fact, I was so enthusiastic after the data were first available to us. I at the very same time, happened to have a very young woman with a neglected breast mass and a substantial hepatic disease burden. We had very little time to get control over this.
Wow.
And I felt like just what you said. The number of patients who were de novo, the number of patients who had heavy visceral burden, the high response rate. I was so enthusiastic about the notion of being able to use this regimen. Now, unfortunately, there was not an approval for her for that regimen. But these are the patients that, or the enthusiasm should go beyond just the amazing progression-free survival prolongation, et cetera, but that upfront ability to take somebody, salvage clinical situation, and then offer them years of disease control in life.
The other thing that I thought was really interesting is among the 85% that responded, there were, I think, about 15% that had complete clinical responses, which is almost double that of the control arm. What do you make of those complete responders? Are they some of those exceptional responders maybe that will have these years and years of durability, perhaps?
We've seen that, right? I mean, in smaller percentages of patients in other HER2 trials in the past, and we all have those patients. We have those patients who are without evidence of disease for years on anti-HER2.
Apparently cured.
Yeah, exactly, where you really start to think about we're getting into a realm of how are we going to think about duration of treatment in those patients. About saying when we fortunately have a lot more molecular diagnostics that we might be able to harness for those decisions.
That is a great idea, and I know there are study proposals to look at that issue if there's evidence of minimal residual disease in the blood or not in those exceptional responders who have complete clinical responses. Maybe that could help guide and give patients encouragement that they could take a break from their medication. Many of my patients who have these exceptional responses, they're so superstitious they don't want to stop ever, right? It's hard to talk them.
100% agree, yeah.